Good morning, bonjour. Well, my name is Rodolfo Pacagnella. I'm a nutrition. I work at the School of Medical Science at UNICAMP, and I'm proud to be involved in the health track of the, I will call it in Brazilian Portuguese, BIOS, which is the Brazilian Institute of Data Science. I will present some how we are going to organize it here and how our things are. We're planning to move forward. Well, the Brazilian Institute of Data Science is a living AI lab with the capacity to produce and disseminate applied knowledge in data science and to connect universities, corporations, and startups within an integrated research and innovation ecosystem. This is the idea that brought us together since the beginning of the project. We started this around 4 years ago, and we are at the beginning of our journey. With this in mind, we joined together a couple of institutions all over Brazil. Federal University of ABC, ITA, Fiocruz, Federal University of Amazonas, University of São Paulo, and within UNICAMP we have the participation of many of our institutes. And also we have some partners from private sectors, considering co-founders with some of them with us since the beginning, as FITEC, CPQD, Templo, and Hospital Albert Einstein in Brazil. And also other partners that constitute the Center for AI and that is called Brazilian Institute of Data Science. Since the beginning, we joined together. Our missions are to transfer technology with cooperation with industrial partners, to research, developing from basic research to applied research using AI as a tool, and education and knowledge diffusion. Our main goal is to propel artificial intelligence in Brazil and in different phases, including crucial problems in the fields of interest, which at this moment are health and agriculture. We organize in two problem tracks and one methodological track. We have a health track and agriculture track that brings us the problems that we need to try to find solutions. And we have a methodological track that aims to look for the solutions that we need to apply to these fields. And also we have transversal axis that brings together both agriculture and health tracks, and also with the methodological track bringing us together in finding the solutions. Speaking about the health track in specific, we organize it in three axes. we need to find, we aim to find solutions for AI, using AI for problems at the individual level, at the community level, and populational level. This brings us to an image that was shown to us yesterday. And without knowing that, we are kind of in the right way of organized thinking about this field. I will show some of the main research project that we are developing in each field, but as I am obstetrician, I'm bringing to my side, from my side, I'm bringing out most of the problems, and we decided that the first 2 years would be focused on maternal and women's health problems. Within the line, the axis of individual level, we have 2 lines of actions, and we have a couple of projects going on, and with some results. We have discussed and worked on design and construction and validation of risk classification systems, aim to bring risk prediction and pattern recognition for particular problems. We work in image-based diagnostic support. We have a couple of studies in this. We have discussed some, you have seen some of the studies yesterday. And at the community level, we aim to build clinical decision support system for the health system. We have in Brazil a universal health system that we call SUS, and within this health system, we are aiming to produce some or some kind of decision support systems to help, especially in my field, to help identify women at risk of maternal mortality, women are at risk of severe situations. During these years, we have developed the integrated monitoring systems for pregnant women. During the COVID pandemic, we are organizing strategies to put together both rules and data-driven solutions for the classification of problems. And we are trying to identify from the medical records some ways to improve our system of informations using natural language processing. One of the products that I want to go in deep with you is the clinical decision support system that was developed in the partnership with the IFF, Fiocruz in Rio de Janeiro, and the FITEC, which is one of the partners that we have in the INPIOs. The SADEC is a clinical decision support tool that using both rules and data to support the identification of severe maternal conditions. In Brazil, we have a high, middle-high maternal mortality rate, and mainly due to the lack of identification of the severe symptoms by the health professionals. So this device or this application aims to reduce the delay in the recognition of the problems and maternal care. We have built 6 calculators and alert scores and help health professionals to identify those women that needs to have treatment for example, preeclampsia, for sepsis, for postpartum hemorrhage, for severe acute respiratory syndrome. This is built in the base of flagging some kind of situations, using a minimum of information to return, to give the health professional the ability to identify those women at risk. At the populational level, we have also identified some clusters of interesting, and we are working with the identification of preterm birth, small for gestational age, and in relation with some kind of risk factors, using AI as one of the main drivers for this information. One of the risk factors that we are seeing recently, and this is part of the transversal axis in the BIOS framework, is the relationship between the climate change and maternal and perinatal health. With this in mind, we developed a data repository bringing together information data from national health systems and hospital-based information and climate to identify clusters of risk, to identify the relationship between the climate change and pollution and the maternal and perinatal outcome. The Climaterna is an open platform with open data, with the ability to show some of the association between space, climate, and perinatal outcomes. We brought together information from the National System of Information, both mortality, birth, and together with the most adequate model for climate in Brazil. But the thing is that we are building this with the capacity to share this information with other important data sets. To do this, we are using a common data model, especially in health. We are using the Observation Medical Outcome Partnership. This is one of the points, the main points that offers us the ability to share information with other data sets. We aiming to offer this information for researchers, for clinical use, and also for political development of public policies. In this dashboards, we aim to put together and easily present the information for those who need to have this information, including the women and children that are impacted with the climate change. So we want to impact the policy development, public health management, and also research advancement. With this data, we are now in progress of analyzing the data, but we are already seeing some important changes that are related to maternal and perinatal care. For example, the wet bubble analysis showing an increasing area and territory that are impacted by the climate change. We see a hot and dry conditions increasing all around the Brazilian territory, and this is impacting the growth, the fetal growth, and also the preterm birth. We can see an important cluster of distribution is around our country. And with the first experiences, we are now in the going to the third year of research in this field. We are having some good achievements. We have been awarded with some research, and both national and in international settings. But looking back at our missions, one of the missions that we have is to educate and knowledge diffusion. With this in mind, and with the need to involve the telehealth and telemedicine in the research area, we came together with a startup called SAS Brazil, and we brought together, we built what we call the Living Lab, which is a laboratory for dissemination, research, and innovation, focusing on telehealth. The Living Lab is improving the telehealth use and research within UNICAMP, and we are expanding this to other areas. Now we are including these in undergraduate studies in medical area, nursing, and all health-related areas. That means that we need to. This is an opportunity to improve the influence of bios in different ways. But look, when we look at the main goals, our mission goes beyond publishing scientific papers, and we need strategies to have impact in our society. We're committed to enabling the development of genuinely resilient technology ecosystem, what we are calling .br. We need that to improve our science and our knowledge, and also our innovation capacity. To achieve these, we must impactful interdisciplinary research, and I think that we are going in a good direction through this. We need to educate and train professionals across all disciplines, and we are going slowly, but we are going this right direction, and we need to disseminate knowledge. But to put it all together, to work with health, agriculture, and to develop methodologies for AI use, we need data. And that's why we need to build some strategies to put together important data that we need for to develop all our goals. we are organizing within the Brazilian Institute of Data Science the ReBIOS, which is a data repository enabling the training of AI models while preserving data privacy. The ReBIOS integrates data sets from public and private sources, harmonized with, for example, in the health track, in the health information, we are using one common data model called OMO to provide the possibility to share information with other data sets. Actually, I don't understand this architecture, but I need to show you. This is the ReBIOS you do. Yeah.
I can explain.
Yeah, please. But the ReBIOS is built in open source, the architecture for to bring together this data and help us to improve the knowledge. We think that one of the main strategic advantages of health sectors today is its intrinsic ability to generate massive volumes of real contextualized data at scale. But more important than the quantity of data, health data has its special characteristics that demands curation, governance, and ethical use. We know that most of AI processes and solutions that are in the literature are not, in fact, executable in the front lines of clinical practice. And so we need to improve how we make, how we develop, and also how we use this technology. This is a study that we are finishing during this time, and we screened. This is systematic research in which we screened AI models, AI tools that could be that should be tested in real population and real settings, in clinical settings. From 9,000 first screening, we end up with 72 studies. That means that less than 0.01 of the studies are tested in clinical settings. That means that we are not ready to use AI tools in clinical contexts. But especially for that, we need our data. We need our data to develop, we need our data to test, we need our data to make AI adapted to our world, to our communities. There is no non-discriminatory AI without representative data, and so we need to build this. This is a matter of surveillance. In Brazil, we are developing the national network of health data, which is, as far as I know, a data repository with 1 point of conversion of data. The federal government is organizing all the public information in this data repository. But I think we need to go beyond that. I think that we need to go in a system that we can use. We have our own data from our perspective, from our community, to build a possibility to share this information, for example, in the further learning process. That means that moving from a one centralized network to a more diffuse network is one of the direction that we could go. And this is a provocative question that I should bring to you. Isn't it possible? Is it in our hands to build such a network that could inform also and could participate in a national and including an international network of data repository of health information? I think that we need to go in that direction so we can have the creation of the data while we can build a better and higher possibility of in using the data for AI research. Well, to finish on my presentation, BIOS AI healthcare encompasses 3 axes: individual, community, and populational axis. Our focus is on development and research, technological solutions aiming at the Brazilian population and public health system. We strive to balance high-impact scientific production with delivery of technological products to our community. And we all here are at the position of thinking of strategic projects that can synergistically improve the ability to produce health and science. That means that I'm seeing many points that we can work together, both BIOS and INRIA, and also within the Brazilian institute that presented here yesterday and today, especially Fiocruz, which is working in the same direction that we are. This is a claim to bring us together to make the best for us. Thank you so much.